Hi, this is Dr. Mike Van Thielen. This video talks about our functional system because imbalances in our functional system, for example, our muscles, can be a causative factor of many of the pains and symptoms of fibromyalgia. What is a tight muscle? A tight muscle is a shortened muscle. In a tight muscle, the intramuscular pressure is increased, which compromises the microcirculation. A compromised microcirculation or impaired blood flow causes pain in three different ways. Number one, it impairs the venous outflow, which causes substances such as waste byproducts to accumulate. This causes pain. Number two, ischemia causes sensitization of pain receptors in the muscle. This results once more in pain. And number three, ischemia causes hypoxia, which interferes with energy or ATP production. All situations in which energy demand is higher than the energy supply causes pain. Now, what causes these muscles to be tight? Number one, muscular imbalances. Poor posture or malalignments, for example, forward head posture, kyphosis, scoliosis, decreased or increased lumbar curvatures, pelvic malalignments, sacroiliac joint rotations, leg discrepancies, post-artificial joint replacements, etc., causes muscles to be out of balance. One muscle group may be stretched while the opposing muscle group shortens or contracts. For example, people with a stooped forward posture exhibit shortened muscles in the front, the anterior muscle groups such as the neck flexors and the pectoral muscles, and lengthened muscles in the back, such as the thoracic paraspinal muscles and rhomboids. People with a scoliosis, for example, have shortened muscles on one side of the spine, the concave side, and lengthened muscles on the opposite side, the convex side. Another reason for muscular imbalance is repetitive movements or overuse of certain muscle groups. This can be related to a profession or hobby. Number two, secondary muscle guarding. When a derangement or structural injury takes place, our body automatically will try and protect the area of the injury. One way is to contract or tighten the overlying muscles. An example is that of a herniated disc. Most of the pain is caused by the muscle guarding and covering or protecting the injured area and not the herniation itself. Number three, fibromyalgia and chronic fatigue syndrome. Certain conditions such as fibromyalgia and chronic fatigue syndrome can result in tight and shortened muscles. Muscle tightness results in, number one, degenerative arthritis, osteoarthritis. A tight muscle causes limited range of motion, joint malalignment, and increased pressure. Number two, tendinitis, tendinosis. The tendons connect the muscles to the bone. A tight muscle exerts excess pressure on the tendons, and as a result, the tendons get inflamed and eventually get diseased, tendinosis, and/or they scar up or tear. Number three, nerve entrapment or nerve impingement. Nerves run through muscles, and when muscles tighten up or shorten, the nerve can become entrapped or impinged. Often, there may be no damage to the nerve itself, but due to a lack of oxygen and nutrients, nerve function impairs and neurological symptoms such as numbness, tingling, and burning sensations may occur. Number four, radiculopathies. When a tight muscle irritates a nerve root exiting the spine, radicular symptoms such as sciatica may appear. Number five, referred pain. Radiculopathies and neuropathies are examples of referred pain. The pain is perceived at a location other than the site of the injury or origin of the pain. Referred pain is the result of a network of interconnecting sensory nerves that supplies many different tissues. Referred pain can also occur from a muscle to other deep structures, such as joints, joint capsules, ligaments, and the skeleton. These deep structures get inflamed or stretched. Reflexogenic muscle tension is experienced in the muscles within the same segment of the involved muscle. And last but not least, local pain. Local pain is experienced due to the impaired blood flow, which causes ischemia, hypoxia, and the accumulation of painful substances. Let's discuss tender points versus trigger points. In fibromyalgia, the muscle involvement is homogeneous. In other words, the muscles in all body areas are affected uniformly. In myofascial pain syndrome, the muscle involvement is heterogeneous. The muscles in various areas of the body are affected differently, and the fibers within each muscle are affected differently also. In fibromyalgia, we observe tender points, which are areas of mechanical hyperalgesia. The locations correspond with areas where the muscle inserts into ligaments or bone, or corresponds with a muscle tear. The tender points are caused by neurogenic inflammation and/or primary or secondary hyperalgesia. In myofascial pain syndrome, we observe trigger points. Symptoms include pain, a tight or taut band, local twitch response, referred pain, restricted motion, weakness, and autonomic phenomena. Perpetuating factors. The mechanical factors include leg length discrepancy, meaning one leg is shorter than the other leg, causing an imbalance. Number 2, small hemipelvis, one hip bone is shorter than the other or smaller than the other. Long second metatarsal bone in the foot and short upper arms. Systemic factors include hypothyroid. Symptoms include widespread trigger points, cold intolerance, fatigue, constipation, and possible elevated serum cholesterol. Hyperactivity is an unexpected sign caused by constant body movement in an attempt to generate heat. Muscle cramps, stiffness, and pain occur as a result of muscle overactivity. The most useful test is the highly sensitive thyroid-stimulating hormone assay. Next, reduced folic acid levels. Symptoms include feeling cold, tending to have a low cholesterol level, diarrhea, possible headaches, disturbed sleep, and restless legs. The best assessment is done by measurement of serum folate, serum vitamin B12, and red blood cells folate, because the enzyme transport system that brings folate into bone marrow is dependent on B12. Impairment of DNA synthesis by either B12 or folic acid deficiency leads to megaloblastic anemia. In people with intrinsic factor deficiency, B12 is administered. In people with restricted intake of animal food products, B12 supplementation is essential since it's only available from animal sources. Number 3, iron inadequacy. Symptoms include unusual fatigue, exercise-induced muscle cramps, and cold intolerance. Mostly seen in pre-menopausal women who have inadequate iron intake to replace menstrual loss. People chronically taking NSAIDs can also have microscopic GI blood loss, leading to depletion of iron stores. The best test to measure tissue iron stores is measuring serum ferritin levels. Iron is important in heme enzyme function. Also, iron is essential for the conversion of T4 into the active form of T3, which may be a link between these conditions. Fibromyalgia patients should get a functional evaluation by an experienced physical therapist or chiropractor to assess for postural malalignments and muscular imbalances. If indicated, postural and corrective strategies and exercises can be prescribed. For more information on fibromyalgia and an easy-to-implement action plan to put fibromyalgia into remission, please visit my website, mikevantielen.com.